Hello, my name is Dr. Harpinder Shivchenko from Smiles by the Sea Family Dentistry in Hampton, New Hampshire. And I often do get asked questions about crowded teeth. I am going to answer some of those questions today for you. One of the questions that I do get asked is, what causes crowding on the teeth, and also how does it affect my oral health? So I'm going to be answering that question. So what causes crowded teeth is, most of the time there could be a couple of reasons for it, but one of the biggest reasons is that, as our jaw is developing, your jaw growth is not compared to what your teeth width would be. So a lot of time that is one of the main reasons for crowded teeth. Other times it could be that also your size of your teeth is also wider than the size of your jaw as well too. So those are a couple of the main reasons for getting crowded teeth. And how it impacts your oral health, actually it has a very big impact overall long term for the health of your gums and the health of your teeth. Because when your teeth are crowded, you have a very difficult time to brush your teeth, remove the plaque effectively. And as we all know, plaque is all bacteria that causes decay, that also causes your gum disease as well too, because bacteria are not only causing cavities, but they're also bacteria who are affecting your gums as well too, leading to puffy gums, bleeding gums, infection in your gums, recessions, bone loss. So overall, crowded teeth long term can have a very detrimental effect on the longevity of your teeth, even leading to tooth loss as you get older. So those are some of the effects of having crowded teeth and how it relates to your overall long-term health of your teeth. Another question I do get asked is, what is the difference between mild crowding, moderate crowding, and severe crowding? So it's basically, as the names describe, is the extent of crowding. So mild crowding could be that, two of the teeth could be slightly overlapped, or they could be slightly behind each other. So that is a mild form of crowding. Could be one tooth, could be two teeth, but overall, normal person might not even realize that there's a crowding. A lot of times patients say, oh, my teeth are good. Cosmetically, they have no concern as well too. There's not as much concern health-wise, short term, but long term it does affect because it creates certain other things over time. So second one is moderate crowding. That's like a bit more severe form of crowding, where you could have multiple teeth which are overlapped or they're behind each other. It could be even one tooth which is really far behind. So that's a level of more crowding. And then the next version is the severe crowding, where patient has, as the name describes, a very severe form of crowding, where a lot of teeth are overlapped, they might be behind each other. The access to those teeth is very difficult. And a lot of times patients also complain that when they're eating food, there's a lodgement of food in between. And also, particularly, a lot of patients, complain that small seeds get stuck in between when they're eating, and there's a hard time flossing them, brushing them, which also leads to a lot of tartar buildup. And again, as we talked before, leading to long-term, very harmful effects on your teeth itself, your bone, your gums as well. Another question that I do get asked is, what are the options for correcting the crowding? So correction for crowding, or getting rid of the crowding, is done with different means. It's basically uncrowding those teeth, and it's called orthodontia, orthodontic tooth movements. Traditional way is by doing braces. That has been long time has been used. And the other way is by clear aligner therapy. And one of the most industry leading and that produces very predictable results is called Invisalign, which a lot of patients are familiar with. So those two basically are the ways of correcting your crowding, putting your teeth in the place where they normally should be. Sometimes, depending on if there's tooth loss or enamel has been lost. Sometimes mild crowding can also be corrected by doing crowns and veneers as well too, where the lab actually creates that, resets your bite basically, and eliminates the crowding. So those are a couple of the ways to uncrowd your teeth. So one other question I do get asked is, how does Invisalign or braces correct the crowding, and also which one is better? Really great question. So let's answer that. So the braces or Invisalign, it's a slow movement of your teeth. With the braces, the difference between braces and Invisalign is that braces, you have a wire which is connecting all your teeth, and your teeth are moving. There are brackets on the teeth. With Invisalign, you're wearing a tray, and it's the movements are actually built into the tray. So your teeth are slowly moving into the position, which is a healthier position, ideal position, so that you can maintain your teeth for the rest of your life. And then which one is better is actually determined most likely by your dentist. Once they examine your teeth, they're going to find out which way is the better way of correcting the kind of crowding, the amount of crowding you have. Nowadays, a lot of times we are able to actually not do the braces, but correct most of the crowded cases with Invisalign, because it's a preferred way for patients. It's easier for them to wear, and it's more aesthetic as well too. So nowadays, Invisalign takes sort of a lead on versus the braces. Another question I do get asked is, how does crowding affect my bite and the alignment of my teeth? So crowding has a big role to play in how your teeth align with each other, and also what we call is your bite as well too. When teeth are too crowded, you're not going to have a bite that is required like by nature, by normal healthy bite. So when your teeth are crowded, you have unusual contacts. Most of the times patients have unusual contact, which we call traumatic contacts, which lead to erosion of the enamel, which is, as we know, is the most protective layer of our tooth. So it leads to erosion of the enamel, and the forces which are going on the teeth, which are unwanted forces, that's why they're traumatic forces, they ultimately go into your bone. So which leads to bone loss. We normally are not seeing that. It's only seen on the x-rays. So slowly, with that pressure, traumatic pressure, unwanted pressure that's been happening because of crowding, leading to a bad bite, that not only eroding away your enamel, it's getting transferred to your bone. It leads to bone loss. And then also our gums follow the bone. So it leads to recession as well too. So again, crowded teeth, malalignment, leading to a bad bite, leads to eroding away the enamel, which is the protective layer of the teeth, then which leads to your teeth getting more decay, getting more prone to the decay, and also you're losing your bone, which leads to recession as well too, sensitivity. All those issues come because of the crowding and the malalignment. So that's how it affects the crowding and malalignment of your teeth, affects the overall long-term health of your teeth. Another question I do get asked is, how long does it take to correct severe tooth crowding? So the answer is that severe tooth crowding, as we know, it's a severe tooth crowding. The time can vary from patient to patient, but typically on an average, we can correct that crowding from anywhere from 1 year to 2 years, depending on, it could be a combination of braces, it could be just Invisalign, it could be just braces. So on an average, from 1 year to 2 years. I hope I was able to answer most of your questions about teeth crowding and also malalignment, and what are the ways to correct that and how long it takes to correct those kind of severe cases. If you have any other questions, please feel free to call our office at 603-926-8827. And you can also visit our website, which is www.smilesbythecnh.com. We will be happy to answer your questions.